Welcome to On The Beat, everyone. Columbus GYN Specialty Center and Health Addition's famous doctor, Dr. Gregory Childrey. How are you, my friend? Welcome to the show.
Doing well.
We're talking a little bit about women's hormones today, okay? But what I do want to start off with is a brief history of hormone replacement therapies and how far we have come. Let's wrap it up in a minute.
Okay. Well, it started back in 1950 when they discovered Premarin. That was our first hormone replacement. And it's progressed to multiple options, from pills to patches to injections to pellets to transdermal creams and gels.
Okay, so it's on every level now. If something's not working, you can try this, correct?
That's correct.
All right, so let's talk a little bit about menopause. Now, I literally just watched an interview about, we know women go through menopause, of course, but what about men? And what is that? And how does it differ?
Well, the difference is in men, there's a condition they call andropause, and that's when men's testosterone levels starts decreasing. And it can start from age 30 on. And for some men, they never see much difference till they get in their 70s and 80s, and other men will hit andropause in their early 40s.
Okay, let's talk about some of the symptoms, because that's super important for women. We'll get away from men just for now, huh? So let's talk about some of the symptoms that women might be feeling.
Majority of women with menopause will have irritability, hot flashes, night sweats. They will sometimes notice dryness in the vagina, decreased sexual desire. There's a whole list of problems they come in complaining of. Some of them it's worsening of headaches.
Okay, but I have also been told, doing this for so long, that menopause can come on very early in life as well. What are you seeing out there?
Well, we see women as early as in their mid-30s, sometimes going through natural menopause.
And why is that?
We're not exactly sure. Some people have tried to blame it on growth hormone or something in our environment, in our food.
I was going to say, is it environmental?
We don't know for sure. They keep studying it, but we have no real answers.
All right, well, we're going to ask Doctor, what are some of the treatments that you're offering to fix this? Because when I first came in to meet you and we were discussing this topic, you surprised me with the variety that you do.
We do offer oral therapy with tablets. We offer injectables. We offer hormone pellet therapy for people that need that, where we place a pellet into the subcutaneous space in the hip region, and that is slowly absorbed over about 3 months. Some people have tried topicals such as the transdermal patches and even creams and gels.
Okay, let's get back to the pellets. Now, you say they last about 3 months, and then what happens? Explain that.
In women, the pellet therapy will last about 3 months, and then we redose them. So 3 to 4 times a year we are dosing women that need the pellet therapy to take care of their hormone needs.
Okay, now HRT, how do you know if you need it?
First off, people come in with symptoms, and to confirm that, we can do blood testing to show that their levels. Okay, we send them to the laboratory, get blood drawn, check follicle stimulating hormone, estrogen levels, testosterone levels, and see if they are in a menopausal state.
Okay, and that's all through your blood work?
Yes.
And we want people to also know that that is through insurance, or how does that all work?
It varies from insurance company to insurance company. Most of them will do the initial testing with their insurance, and of course you got your deductibles and copays before we know what's covered.
Okay, now we get the results back. We find out that we need HRT. How do you know what? Are we using the oral? Are we using the pellets? Are we using creams? How do we know what works?
A lot of times it has to do with patient desire. Really? Your oral therapies are going to be least expensive, and if they don't need testosterone supplementation, most of the time we can control them that way. But the only safe way that I've found to use testosterone to get good absorption is through the pellet therapy.
Okay, well, we appreciate you coming in and giving us a brief oversight for what all our wonderful women in our lives go through. How does that sound? Thank you. If you want to find out more information about Dr. Childrey, there it all is up on the screen, everyone. Columbus GYN Specialty Clinic and Health Additions. They're the team to see. Back after this short break, everyone. You're watching On The Beat.